I want to take it just one step further in the hormone replacement argument. There's a question about whether or not HRT is safe. I think I've made a pretty good point that if it's done properly, laboratory studies are done to make sure you're in a safe range using natural compounds. It's safe, it's helpful, it's effective. It doesn't have zero risks, but the risks are low. But when they do all the studies, when all of this information is checked and looked at, the question is, are the benefits enough to support the risks? Well, we've pretty much shown that you can really limit the risks. Not zero, but real low. So what are the benefits? Well, your bone density, that's the big thing. Your bone density, your bones are stronger with hormone therapy. They make the case that you can take a synthetic drug that causes esophageal erosion. That means bloody holes in your swallowing tube that eats through your stomach lining, that makes your jaw so weak that it gets infected and can break. I don't know if that's a really good, safe therapy to replace hormone therapy with when we have safe hormone therapy. What do you think? It doesn't seem to make any sense to me. So if the point that's being made is that, well, there's other alternatives for osteoporosis, but they're very toxic and very harmful, I think that misses the point. If you need to have your body strengthened, if you want your bones stronger, if you want your sexual function optimized, if you want your skin to look good, if you want your brain to work well, if you want your heart to contract powerfully in a very, very good contraction, providing great circulation to your whole body, you're probably going to need hormone therapy when your hormones decline with age. Do you want to take synthetic drugs to support a single function in that group? Probably not. So don't buy it every time that a new article comes out and says, well, we think that conventional therapy is much safer in the big picture. I don't agree necessarily. You need to work with a doctor who's really well schooled in hormone replacement therapy and understands it well, so you can balance what do you really want, what do you really need, and what's available. Work with your doctor, get the best natural treatment available, because we're better together.